I spent 25 years in medical practice, and 16 of it, well, actually he said 14, but 16 of it I've been in solo private practice. I have been in the university, and much of the policies that are written by physicians come out of university doctors. And I'm not trying to insult any university doctors, but they don't really pay their own bills. As a spine surgeon, I go to the operating room 2 days a week, but then I'm in my office as a small business owner. I have to pay my light bill. I have to pay my staff's Christmas bonus. I know what it is to run a small business. And you ask yourself, if you've run a small business, if you actually produce something, when has the government come in and made your job easier or more cost-effective? If the answer is it's never done that, trust me, it doesn't do it in medicine either. But it tells us that what they're going to do is they're going to come in, and they say that they need to come in because they need to increase quality, they need to decrease cost, that's a joke, and they need to increase access. Now, all you need to know about quality is this. When Boris Yeltsin needed his heart surgery, what did he do? He had American-trained physicians at the Soviet Union, and he hired Dr. DeBakey, who was in his 90s at the time, to leave Texas and go over and supervise. He didn't go and get his heart surgery in the universal health care free government system that he had created for everybody else, because he was Boris Yeltsin. That was good for the gray masses. Where Ralph came from, 2 former premiers, at least 2 that we caught, of Canada snuck across the border in the dark of night to come to America for their health care. If government medicine is so good, why didn't they stay home? When the Sultan of Brunei needed his cancer care, he came to America. I know, my friend took care of him. Now, there's a reason for that. There was a Lancet Oncology Journal article a few years ago, and the Lancet Journal of Oncology is the cancer journal from England. And they looked at I think there were about 20 countries, and they looked at survival of cancer from all these different countries. And guess who was the best? The United States. On every thing they looked at, we had the #1 survival from cancer. And this wasn't chump change difference. If you're a man, I remember this number, if you're a man in America and you get cancer, you have and this is lumping all cancers together, you have a 65% 5-year survival rate. If you're in England, and God love them, they just celebrated the 50th anniversary of the National Health Service. If you're in England, your survivability is 45%. That's a 20% difference between your ability to survive cancer in England versus the United States. And it's not much better in that darling of the left, Sweden, which is 48%. Now, my friend who took care of the Sultan of Brunei, he went over to Sweden. He has Swedish relatives, and he decided to check in with an oncologist, and he found out why this probably is true. He said, now he's 70 years old, and he still sometimes sees 50 patients a day. He's busy seeing oncology patients because we're short of oncologists. The guy in Sweden, after he saw 12 patients, closed his door because the government only paid him for 12 patients a day, and that's all he was going to see. There were people who'd come from 200 miles away waiting in the waiting room, got to come back tomorrow. That's cancer care elsewhere. Now, honestly, the reason I'm saying this is because we always hear, we don't want government, or we need government medicine because, we pay all these dollars out, and yet we don't live longer than everybody else. In fact, we don't live as long. We have all this perinatal mortality, people dying around childbirth. But I'm going to tell you, those numbers are distorted because what they do is they pick things that really don't matter. Even Wikipedia agrees that longevity is genetics and lifestyle. Well, we kill a lot of people on the highway. Luxembourg is 20 minutes coast to coast. They're not going to kill people on the highway. They just don't have the same issues. And in Cuba, for example, you don't get a birth certificate until you are 2 to 3 months old because that gets rid of all those perinatal deaths. So many people die around the time of birth in Cuba, they don't want to deal with the paperwork. They don't want to waste their bureaucracy time. So come back at 2 months, we'll give you a birth certificate. Well, that kind of gets rid of those uncomfortable statistics. And in Switzerland, they don't count live births, unless you're 30 centimeters, which gets rid of all premature infants. So they always trot out those statistics, but those statistics, trust me, are not measured the same. What you really want to know is when you're sick, where do you want to go? And the Sultan of Brunei knew, he came here. Now, I want to tell you a little bit about, Ralph wanted me to talk about how government gets in the way every day. And let me tell you about my hospital. I went from a big trauma center type hospital, and I'm gotten a little older, so I decided to kind of slow down. But I work at a hospital that has very good quality care. And there's a test that we've been doing for 20 years all over the country. I think it's about 20 years old, for DVT testing. In other words, if you get a blood clot in your leg, you want to know it because that could potentially kill you. And it's called a Doppler ultrasound. Now, we've done this thing for years. It's done by a radiology technician, specially trained, certified in ultrasound. It's managed or read by a board-certified radiologist. So this is not a fly-by-night organization. 6 months ago, Medicare said, you can't do the test anymore until you get your technologist specially trained in doing this test. And we said, wait a minute, she's been doing it for 20 years. Doesn't matter, you have to get specially trained. Well, okay, how do we get this special training? Oh, it takes 2 years. Now, we're a small facility, so we don't have 10 ultrasonographers, and we don't have anybody coming as a new graduate. So we have been shut down from doing this test. Now, let me tell you what this practically means. We used to, if you're a hospitalized patient, you get sick, that's a risk of having a blood clot in your leg, and you want to know this quickly. So what we would do is we'd bring you down the hall to ultrasound, do the test, takes 10 minutes, go back to the ward, and we'd have an answer within an hour. Medicare paid for that $235, okay? Now what we have to do is, first of all, somebody has to call around and find a hospital willing to do the test. Then we have to bundle you up into an ambulance, drive you 45 minutes to an hour. You wait around in their facility where nobody can really micromanage that you get pushed to the priority, and you come back in the ambulance, and then we unbundle you and put you back in bed. Now, you haven't had a doctor or nurse supervising you this whole day, and I'll be lucky to get the answer in 8 hours. So it's certainly decreased quality. I mean, quite frankly, and this is happening all over the country. We've been fighting this for 6 months because we're going to kill somebody. I mean, this is really not good. So it's decreased quality. It's vastly increased the cost. It went from $235 to $235 plus about a $3,000 ambulance ride. And here's what you should really pay attention to. It decreased access because not only is a Medicare patient getting hosed, let's say you come into my hospital and you have Blue Cross Blue Shield or some other insurance. You've saved up all your life, you've bought your health insurance, you've been a responsible citizen. You're laying in that bed. Well, we said to Medicare, can't we get them? Can't we do the test on them? No, because that would be discriminating against Medicare patients. So even though you've paid for the service and paid for the insurance, you can't get the care, which is what's happening in England where they say they have a two-tiered system, but when the government takes over the vast majority of health care and the bar starts coming down, even the people that can pay and get out of that system won't have it available to them. And so they've lowered the bar on everybody to make equal, they like to say equals quality, equal standards for everybody. Yeah, they've lowered that bar for everybody, so now everybody's getting hosed. It's terrible. I mean, some of these regulations are really kind of funny. I mean, I was telling somebody earlier, you can't use door stops on fire doors in hospitals. Well, okay, because they don't want you to prop open a fire door. If they catch you with a doorstop and the inspectors come through, you can get dinged, okay? I found this out because I was looking for traction weights. I don't know if you had this experience. I was looking for traction weights. I had to find a whole bunch of traction weights for this great big guy that I was putting traction in the ER. Couldn't find them. They were using them for door stops because you can have plausible denial from traction rates. I mean, this is the kind of stupid stuff that these guys in Washington come up with, these stupid regulations, and this is the practical world. Now, so the other thing is cost. Everybody says, oh, medicine costs so much, that's why we have to have the government come in. Let me just tell you, I can go down to Walgreens, and the cost of an aspirin is 2 cents. An aspirin in a hospital that takes Medicare is $18. I looked that up. Now, the reason is because of the 160,000 pages of Medicare regulation and the constant monthly updates that make it a shifting sand that we have to be in compliance with to give you that aspirin. I'm old enough to remember when we could just give it to you like this. We didn't have to do anything, no paperwork, we just handed you an aspirin. Not anymore, no, we have to do it all through there. Now, I have a son going off to medical school and one's starting engineering this fall, and I said to them, I have 10 minutes to tell people why not to do government medicine. What do I say? And interestingly, they love to debate philosophy, and they said, make the ethical argument. It's just not ethical to have a system that puts a gun to your neighbor's head and forces that person to pay for your mother's broken hip. I mean, no matter how noble, and you touched on, no matter how noble the goal, that's not charity when you do it by force. Okay? And ultimately, all government medicine is done by force. Now, the other point is that by the nature of government medicine, it will always devalue the individual in favor of the group. It has to make choices between who it's going to fund. And it doesn't say, I'm going to not treat Peter, I'm going to treat Paul. What it says is, I'm not going to treat Peter's disease, I'm going to treat Paul's disease. It's a utilitarian theory of healthcare. And we saw the result of that in the mid of the 20th century. It's saying, you don't deserve to live because we have to save these. You're 60 years old, you need dialysis. We're going to use that money and to vaccinate children. And so, it sounds good. Yeah, children need care, and you're not working, so your life is not worth living. Now, if you think that this is just far-fetched, we've already lived through the 20th century, not going to happen again, read Ezekiel Emanuel's article in The Lancet. You can Google that and find it. It's Rahm Emanuel's brother, and he talks about what they're going to do when they take over all healthcare and have the pot of money, and it's very scary because there's a graph, and it shows if you're under 2 years old, I guess they don't think you're people, or if you're over 60, you're not going to get any funding. So, just kiss your ass goodbye if you're 65. I'm about there. So, and the final, when I have a slide, I actually have a slide of somebody bending over, touching. finally, I have to say, there's an underlying assumption here that I really resent. And that underlying assumption is that you and I and all my fellow Americans are too incompetent to sort this out ourselves. For 200 years, we took care of ourselves. We took care of our communities, our family, and we helped with charity. But we're not doing it anymore because now the government has told us how we're going to live and that we can't do it. And I just don't think that's right. So anyway, you heard it, the AAPS, we're the only organization to legally challenge healthcare because we believe that medicine is between a doctor and a patient, not between a doctor and a government bureaucrat and a patient. Thank you very much.